Hello everyone, we're in the studio today with one of the top facial plastic surgeons in the Dallas-Fort Worth area. It's Dr. Yadro Ducic. Thank you for joining us today.
Thank you for having me.
Of course. So you're double board certified. Tell me a little bit about what other areas you specialize in.
Well, I do a fair amount of reconstructive surgery as well, so we deal with a lot of facial trauma patients, head and neck cancer patients, skin cancer patients, and it's a lot of those folks you're removing parts of their face and then reconstructing and rebuilding them, and it really kind of flows nicely into cosmetic surgery because you're doing similar sort of things. It's all about making people feel better about their appearance and function better.
That must be very rewarding. What would be one of the most rewarding parts of your job, would you say?
You know, I think one of the best things you can possibly have is when the patient's happy with their end result, especially if they are reconstructive patients. If they've had a trauma and everybody's always very afraid of what they're going to end up looking like, and then you bring them back to something that looks pretty darn similar and sometimes even better than what they started off with, it really brings a lot of happiness.
So how did you come into this field? What made you decide to specialize in this field of medicine?
It seemed at first to be probably the most challenging part of surgery. Surgery has always attracted me, but especially facial plastic surgery because you really can't hide your work. If you do anything below the neck, you can put a shirt on, a jacket on. Above the neck, it's there for everybody, including patients, family, friends to see. And so it really is challenging hiding scars, doing minimally invasive procedures, trying to camouflage your work and make it not obvious, but make them look better.
So you do the facial reconstruction, but you also do head and neck surgery, is that correct?
Yeah, you know, in terms of the head and neck surgery, what that means is removing cancer, sometimes skin cancer, sometimes tumors of the jaw, tumors of the tongue, face. And so you're creating defects and holes in folks, which can be kind of scary. And then essentially then you figure out ways to put it back together. And the removing part really doesn't surprisingly take very long. But the challenging part is putting everything back together. And that's really what takes the bulk of our time in terms of reconstructing people.
That does sound amazing. Do you have any special cases that you've worked on that are really close to your heart?
Hey, I mean, there's a whole lot of patients that touch you. You know, it's interesting in that you never know why somebody's going to affect you. We'll operate on thousands of patients over the years, but then every once in a while there's somebody that really stays close to your heart. And sometimes it's a cancer patient that's a little bit older, that has a very sweet, loving wife beside them, and you see the way they look at them, and you realize you have to work really, really hard to make sure that they stay together for a very long time. Sometimes it's a mother holding a small baby, and she's worked for years to try to have that little baby, and you want to make sure that you make it as well for her as possible. Sometimes a trauma patient, it's parents bringing in their teenage daughter who was a cheerleader, and they're in a car wreck and they're somewhat disfigured, and you want to make sure that you get them back to the life that they really deserve and have always kind of dreamed of.
Wow, that's amazing. Tell me about how you're the co-director for the Baylor Neuroscience Center for Skull-Based Surgery. Tell me a little bit about that.
Well, you know, skull-based surgery essentially is surgery at the base of the brain. And so most of these patients that have tumors there, and that's what we're talking about most of the time, they're mostly benign tumors. They tend to be younger patients, and they're picked up as what we call incidentalomas, which means you have a headache, you get a CAT scan, and it shows this little tumor. And the problem is where these tumors are located, if they're on top of the skull or just below, well, you do a traditional craniotomy where you come in from the outside. But these are actually behind the face and below the eye sockets and base of the brain. And so oftentimes we can do these endoscopically, which means with little cameras through the nose to take them out. But sometimes we literally have to move parts of the face around and then rebuild it and reconstruct it to be able to get these tumors and then put everything back together. And it's amazing how you can access a lot of these tumors, remove them, and really leave the patients with minimal to no scars. We try to hide the scars inside the eyelids, inside the nose, inside the mouth, inside the hair-bearing scalp. In the middle of surgery, it sometimes doesn't look very pretty, But it's important to have that access to be able to get those tumors out safely. But then at the end, most of these patients do very well, and you really can't tell much of any difference.
So tell me, Dr. Ducic, you have a unique philosophy, and tell me what your goal is with patients.
Well, I hope it's not too unique. I'd hope that most facial plastic and plastic surgeons felt the same way, but you know, by the time a patient comes to see you, for whatever the problem is, whether it's a crooked nose, a mole on their chin, a weak chin, loosening of skin, whatever the issue is, they've thought about it for a long time. They've looked in the mirror, they've critiqued themselves, sometimes they've even shed a few tears. And so the last thing we need to do is to make them feel more uncomfortable about other things. And so I think it's important to address what their concerns are, recommend procedures or surgeries if they're appropriate, and reassure them that they'll do fine even if they don't have anything done. Because the most important thing you want is for them to walk out of the office feeling good about themselves. And the most important thing we want after surgery or procedures is for patients to feel good about themselves. The last thing we want is to create more anxiety by pointing out other flaws, which all of us have. That's what makes us human.
Thank you so much, Dr. Ducic, for joining us in the studio today. It's been a pleasure.
Thank you for having me.
And for more information and to watch more videos on Dr. Ducic, just head to our website. It's bestdocsnetwork.com.